Next, we'll hear from Dr. Adam Law, endocrinologist, physician, scientist, and engineers for healthy energy. Welcome.
Good morning, Chairman Sweeney and Godfrey and members of the committee. Thank you for inviting me today. I open with a resolution passed by the Council of the Medical Society of the State of New York on December the 9th, 2010.
Excuse me, could you pull the microphone a little closer? Thank you.
Resolved that the Medical Society of the State of New York supports a moratorium on natural gas extraction using high-volume hydraulic fracturing in New York State until valid information is available to evaluate the process for its potential effects on human health and the environment. Hydraulic fracturing, shorthand for high-volume, slick-water hydraulic fracturing from long horizontal well legs, has significant effects on human health. From my perspective as a physician and an endocrinologist practicing in the Finger Lakes region of New York State, I would like to make 3 points. First, that there are no high-quality studies in the medical literature addressing the health effects of hydraulic fracturing, and I propose a much more active role for the New York State Department of Health in fostering quality research in this area. Second, classic toxicology does not adequately describe the entire risk to health from hydraulic fracturing, as endocrine disruption represents an emerging potential hazard arising from exposure to specific chemicals or mixtures at extremely low concentrations. Third, as the effects of hydraulic fracturing on health are not adequately studied, and there is sufficient reason for concern, New York State should continue its cautionary approach by extending the current moratorium. There's more than 10 years of experience in hydraulic fracturing in other states, and as I speak, there have been no peer-reviewed publications in the scientific or medical literature addressing its effect on human health. Madeline Finkel, Professor of Public Health at Weill Cornell Medical College, and I co-authored the first peer-reviewed commentary on hydraulic fracturing and health in a high-impact medical journal. This is published in this month's edition of the American Journal of Public Health, entitled "The Rush to Drill for Natural Gas, a Public Health Cautionary Tale," submitted as part of my testimony. During research for this article and also in subsequent systematic evidence-based literature research, my co-author and I have not uncovered a single high-quality study on the effects of this process on health. There are a number of small surveys and state-sponsored investigations, but these have been posted or archived on websites and are not submitted to the standard scientific peer review process. There is increasing evidence of leaks, spills, pollution, poor waste management practices, and industrial accidents surrounding the hydraulic fracturing process. Demonstrating this is beyond the scope of this public hearing. We also know that there are many well-characterized toxins added to the hydraulic fracturing fluid. Despite this, communities, states, the EPA, and even Congress are unable to obtain a comprehensive inventory of the identity of chemicals used in the hydraulic fracturing process, a gap explained by energy companies as a concern for competitive advantage. With the Energy Policy Act of 2005, Congress explicitly precluded the EPA from regulating most aspects of hydraulic fracturing, including any requirement to disclose the substances being injected underground. Researchers and policymakers are forced to play a guessing game to identify these chemicals from the material safety data sheets gas drillers are mandated to produce in case of industrial accidents. Unfortunately, the MSDSs contain proprietary names, and although we can be fairly certain about the identities of many of the chemicals from this kind of time-wasting analysis, we cannot infer the unique chemical identities of many others. From the perspectives of a physician committed to evidence-based medicine, this situation is deeply troubling. Over the last decade, when hydraulic fracturing has come into substantial use in other states, there has been increasing anecdotal evidence of human harm. I remind you, As a practicing physician, the doctor-patient encounter is based precisely upon anecdotal evidence. We term this type of evidence the patient history. I simply cannot dismiss the stories of people living in close proximity to this industrial process. For public health researchers, this kind of data is the equivalent of the canary in the mine, warning us there is a problem we need to study systematically. Thus, in the short term, there are a long list of medical conditions. Here are some commonly found in a single survey in one town: sinus problems, throat irritation, allergies, weakness and fatigue, eye irritation, nasal irritation, joint pain, muscle aches and pains, breathing difficulties, vision impairment, severe headaches, etc. This is alongside the effects of noise, industrial odor and light pollution, all significant stressors in rural communities where people have often chosen to live to be away from these more characteristically urban problems. In the medium term, there are the well-established toxic effects of chemicals and in the chemical additives to hydraulic fracturing fluid, and also in the flowed back and produced waters. These can affect many organ systems, including the liver, digestive, pulmonary and nervous systems. Others transcend bodily systems and affect immune function or are linked to cancer. In addition to toxins, there are naturally occurring nuclear materials in the drilling waste and produced fluid. In the long term, research has focused on greenhouse gas methane at the center of this process. A recent life cycle analysis has demonstrated the purposeful and inadvertent leakage of methane into the air as a potent greenhouse gas alone makes the hydraulic fracturing process at least as damaging to climate as traditional use of coal as a fossil fuel. The contribution of hydraulic fracturing to climate change has an impact on human health. In addition, in a drought-afflicted world, water depletion by both contamination and removal of large volumes of fresh water from the hydrological cycle has a very significant negative health implication. In my opinion and that of public health researchers I've consulted, we need to conduct well-designed epidemiologic studies on the health effects of unconventional drillings. These studies should include particular at-risk populations such as pregnant women, children, workers, in addition to those living in proximity to hydraulic fracturing. This should include a variety of epidemiological study designs, including cross-sectional, longitudinal ecological, case control, and prospective cohort studies. I suggest the New York State Department of Health should take a lead in fostering and funding such a research program, studying the fairly extensive experience of other states where hydraulic fracturing is currently underway. This research should be published in peer-reviewed journals so it can come to the attention and under the scrutiny of other investigators and to the attention of policymakers. I'm a clinical endocrinologist, and my patients present with diseases of hormones in their organs, including diabetes mellitus, infertility, thyroid cancer, pituitary disease, and adrenal disease. My introduction to the health concerns about hydraulic fracturing came from patients asking me how this technology would affect the hormone system in the body. The term endocrine disruption was coined in 1992 in response to the recognition that exposure to minute concentrations of specific chemicals or mixtures, particularly at critical points of development, can result in profound damage in widespread groups of organisms, including humans. Paradoxically, because of the molecular mechanisms endocrine disrupting chemicals interact with hormone receptors, they're often much more potent at lower concentrations and do not show the classic toxin dose-response curve. The endocrine disruption exchange has identified many potential endocrine disrupting chemicals in the hydraulic fracturing fluid. To this extensive list, others need to be added that emerge in the produced fluid from the shale. We need to know more about the chemicals introduced into the environment during hydraulic fracturing. I propose New York State require the energy companies, the drilling companies, and their chemical suppliers to provide the DEC and interested researchers the unique chemical abstract services registry numbers for all potential and proposed hydraulic fracturing chemicals so we can identify and regulate the use of endocrine disrupting chemicals in hydraulic fracturing fluid. We also should study the presence of endocrine disrupting chemicals in the produced waters, volatile gas emissions, and solid waste deriving from the Marcellus Shale itself. My third point is the need for further caution. As a physician, I work within the bounds of a complex system of medical ethics. Two precepts come to mind in this discussion of hydraulic fracturing and its health impact. First, do no harm, and informed consent. Hydraulic fracturing in this context appears to me to be like a large, misconceived experiment in which unspecified toxins are being introduced in an unpredictable fashion to human subjects without any systematic or scientific attempt to establish or quantify its effects on human health and well-being. In many cases, this is done without adequate informed consent of citizens. With economic projections of trillions of dollars in revenue from the sales of natural gas, I think there should be no shortage of resources to design a top-flight research program. I suggest the caution displayed by New York State in establishing a moratorium against unconventional gas drilling is wise, and I recommend that this should be extended until we have thoroughly studied the implications for public health.